here at the UPMC Quantum Building for the open house and grand opening of our child and adolescent services on the south side. I hope that you love this building as much as I love this building. This is a story of a journey, really, in terms of wanting to do a better job for our patients and for their families, to provide for a better patient experience for them, to repurpose this floor of the building to really be a very beautiful, welcoming patient space, perfectly situated for our children and adolescent patients, for our CAD programs, and also it will be for vocational rehabilitation programs as well.
This facility is just another example of UPMC's investment in behavioral health services. We're just thrilled with the clinical participation and development. And I don't want to leave out the hard work of our construction, building, IT, and operational logistics team. They have been phenomenal to work with.
Matt's Makerspace is so delighted to be a part of this new outpatient facility. This space is at the forefront of behavioral health care. When it came to our attention that Western Psych wanted a makerspace, we were so excited to be able to bring it to this community of patients.
To see the investment that UPMC made to really improve the care we provide for the most vulnerable kids, that's something that helps me sleep at night a little better. We'll serve autistic people from birth pretty much until as long as they want to be in the vocational rehab center. We're also going to serve adolescents and children who are sort of just beginning their journey in life and in their mental health journey. And the ability to have the light in that space is just amazing.
People with significant neurologic disorders like ALS, traumatic brain injury, Parkinson's, locked-in syndrome, all have a need for an alternative way to communicate. So that's what we do here.
We have had an understanding over the last several years that we're not picking up accurately the degree to which people can perceive their environment and understand their situation.
Individuals that have a disorder of consciousness, that we are unaware of their level of alertness, this device is allowing us to tap their cognitive function and provide a means for them to answer yes/no questions.
One of the things we're looking at is their ability to follow directions. Can they follow a simple direction like counting the number of vibrations in either wrist?
Okay, so Josh, I'm going to have you imagine throwing a ball. When you hear right, imagine throwing with this arm. And when you hear left, imagine throwing with this arm.
If we can get them to do that, then we can work on training them to answer a yes or no question. And that's the beginning of being able to communicate more effectively.
With this first grant that we received from the Beckwith Institute, we were able to demonstrate feasibility. The first time that we were doing the auditory evoke, our first couple patients that were demonstrating that they were following a command, it was like, oh my gosh. The team was standing around just amazed.
Being able to have an effective technology for understanding that better and for allowing patients to communicate will represent a paradigm shift in how we think about level of function and what's possible for these people.
So this area that we're highlighting today is our behavioral health pod in the ED. And this has been a project in the works for well over a year. The services we'll provide in this area will have a typical medical screening exam by an ED physician, as we do now. If they need more psychiatric care, they'll be brought back to this area.
Sometimes it's substance abuse related, sometimes it's event related, traumatic event related. It can be medication concerns. So the staff that work in the behavioral health navigator position really have a lot of background to do an assessment for these patients that will best suit their needs.
You know, our community has behavioral health needs, and we see a lot of patients come into the ED in a crisis situation.
This area was designed to be less restrictive and more inviting to the patients that we assess.
And that is really proven to be therapeutic to patients' healing and also to de-escalating any patients that come in a crisis situation. There's space for adults and there's space for adolescents, and we're really going to, I think, continue and enhance meeting the community's needs.
We're here with the UPMC in Central PA Nurse Family Partnership Program. We partner registered nurses with pregnant clients early in their pregnancy through the child's second birthday. And we are here today to celebrate our clients and their achievements and accomplishments, and just here to celebrate them and each other, and the support that UPMC is giving us to continue the program. We do. We've got people from several pregnancy testing centers. We've got the UPMC Safe Sleep Coordinator, Amber LaCadre. We've got Parents as Teachers, Healthy Start. Several legislators will probably be stopping by. We've got lots of partners here today to share with us as we all serve the same client population out there in the community.